We're here at HIMSS 2017 in Orlando with Alan Portela, CEO of Airstrip. Welcome, Alan.
Thank you. Thank you for having me.
Yeah, it's great to be here. You know, we've been meeting for 4 or 5 years, maybe more. I lose track. I know we first met at mHealth Summit, which is now defunct and renamed 5 times. So we have a long history together of meeting together and talking. And your insights are always insightful. But I'm interested here at HIMSS 2017, you know, what's changed over these 4 to 5 years as far as an industry?
Well, it's very interesting. I think a lot has changed on. One of the things that just happened is there is a change in the administration, and that will definitely force new change in the area of interoperability, cybersecurity. There is a lot of emphasis on that. I think that the bipartisan support for MACRA is really going to move now into the value-based reimbursement model, and the only way to move into that direction is going to be with true interoperability and cybersecurity, and the government really stepping in to help.
Interesting. So you think interoperability is essential to these shifts to value-based care, and I guess the question is, will the new administration embrace that and make it a reality, or are we, you know, I guess that's an open-ended question, right?
Yes. Well, it's only has been a month and a half of the new administration. All what I can say is that I feel very confident that the Secretary of Health and Human Services, Dr. Price, which, by the way, is the first time that there is a physician in charge of a Health and Human Services department since 1992, I believe, and also now Verma in charge of CMS. I think definitely there is going to be a big push for value-based reimbursement, but there are also other initiatives out there like the 21st Cure Act that was just approved that is also going to put a lot of emphasis on precision medicine, personalized medicine. And there is no way you can get there without having the necessary data to move into precision medicine. So I think that now we're at that point where for the last 10 years, everything was about EHR adoption, utilization, but nothing was about interoperability and cybersecurity. Now that there is a good level of adoption, this is the time really to start pushing and getting to the next level. If we don't do that, then we all implode.
No, I mean, I think 100% that's the big topics of this HIMSS already, and it's early, is cybersecurity and interoperability and getting value out of the data in the EHR. So I think that's pretty interesting. And I think that those two leaders at HHS and CMS are both very provider focused. So I think it will be interesting how that shifts. So what hasn't changed in the industry over all these years that, you know, you've seen?
Well, so if you look at the main issue that I always talk about on interoperability, there was a lot of emphasis on creating standards. But everything, of course, has been about electronic health records, nothing really around medical device interoperability. So on the EHR side, the standards are still very limited. If you look at CCDA on the ambulatory side, if you look at HL7, FHIR, even though they're going in the right direction, it will take a good 3 to 5 years until the key legacy vendors comply with those standards. And 3 years, it will be really too long for us to do anything. And there has been no emphasis on medical device standards. So what happens is, as we're now looking into precision medicine, everybody's realizing that it's not just about electronic health record data. Also, you need to analyze data in motion of when a patient was admitted to the hospital and he was in the intensive care unit. If I really want to understand that patient more, I have to create a physiologic phenotype of how their body reacted to the event they were experiencing and the medications and everything that happened treating that patient. All that data is not available today. It's on proprietary protocols on the medical device side, and it's on proprietary protocols on the EHR side, at least on the top 3 legacy vendors. So the reality is that has not changed, but as the reimbursement changes, everybody's going to be forced to open up. And I do believe that this new administration, it seems to be executing on a number of drastic measures to enforce different things. Maybe they are going to sign some nice executive order that will force all vendors to open up the data and go beyond the standards.
That's interesting. I mean, I think that goes back to the real-time analytics coming from the med devices, coming from the EHR data, coming from our own consumer health data. And, I think we've seen some people try to do that, and we see it in a few cases, maybe in the ED or a few places, but, we need it much more broadly, it seems, in healthcare to be successful.
Yeah, so the interesting thing is that we're starting to see clinical condition-oriented body sensors for glucose, for EKGs, and those sensors that are now the state-of-the-art, new things, they are truly interoperable because there are companies that are brand new, innovating, coming from the outside, not with the interest of creating silos. And the traditional vendors that are inside the acute care space are the ones that do not want to have a bridge between the ambulatory side and the inpatient side unless they are the ones building the bridge and building everything that is outside.
Right. And some of them want to monetize that bridge, right? Which is ruins the challenge. So, you've talked about interoperability as one of the challenges we face. Are there any other challenges that really are strong impediments to the success of healthcare IT?
Yeah, so I think probably even the biggest problem is cybersecurity. So what happens is we are looking at the whole issue of hacking, primarily around hackers coming in and taking personal health information. The real bad guys are not the ones that are interested in personal health information. They're the ones that are interested in going to a large healthcare organization and basically tapping into the network and disconnecting all patients that are on infusion pumps or ventilators. So the same way that you can hack for PHI, you can hack into that. Many healthcare organizations are basically saying right now, well, if they are going to steal PHI, why don't we just get a good insurance, and the insurance will pay every time there is a hacking event. But there is no insurance that you can get to protect yourself from all your patients being disconnected or patients that are on infusion pumps at their home for somebody to hack into that and change your settings. That is a huge vulnerability. But this is an area that is different than interoperability because the standards exist for cybersecurity. It happened before with the DoD, with the DIACAP certification. Then we have NIST Risk Management Framework certification. So those standards already exist. All what we need to do is force vendors to comply with the existing standards.
That's really interesting. I wrote an article that talked about the key to any analytics or data is trust. And if you don't secure it properly, you lose all trust, right? So, if you don't have the right security on the med device, then you're not going to be able to trust that data. Or if you don't have the right security on your EHR, how do we know it wasn't modified? And so then I can't trust it in the care. So I think you're right. I think it's a very important element in its success. What other initiatives are really transforming healthcare as we know it? I think we talk interoperability. I think reimbursement models seem to be doing it with the value-based care, kind of where we started. Any other transformative initiatives or technologies that you see on the horizon?
Well, so at least I can tell you the things that we are working on, because as you know, we started with aggregation of data from multiple data sources, structured and unstructured, medical devices, EHRs. We moved into the normalization of that data, streaming that data on a real-time basis into analytics tools. And as we're moving into that space, we are running into a number of vendors and academic medical centers that have developed clinical condition-specific algorithms for early detection of patient decompensation. So that is something that we already are applying at places like University of Michigan, and we are looking for early signs of patients with traumatic brain injury or patients that have sepsis or predict if they're going to have a septic shock. So we're bringing clinical condition algorithms and also to be able to apply that same technology to those body sensors that you have outside of the hospital. So if you look at the transformation, it goes from opening up the data, securing the data, to clinical decision support using machine learning tools, clinical cognitive computing tools, and then eventually that's how we will get to precision medicine. But all that could happen very quickly because all the tools that I just mentioned, they all exist. It goes back to the root cause, cybersecurity and interoperability. We're all waiting. For the last 10 years, billions of dollars have been spent in healthcare IT to develop all the tools that are necessary. They exist. It's all back to the legacy vendors blocking the data. So I hate to sound like a broken record, but it all goes back to that.
That's interesting. I mean, if you look at the getting value out of health IT, you need access to their data. Then that data needs to be normalized so you understand what it meant from those various organizations. And then you add layer on top of that of action. Okay, what data matters? Where does it matter? How does it matter? And then you have outreach to the patient, which is, I think, another area. I guess both ends of the spectrum to me are where we're missing. One is the access. The data is not flowing freely to where it needs to get to go to be effective. And then at the end, once we know, okay, here's the 300 patients that are costing us the most money. Now what? I think we have to deal with that challenge as well. Any thoughts there about that spectrum? Any other missing points?
Yeah, well, so what happens is when you look at the last step that I was mentioning on precision medicine, that is when it's all about the patient, eventually all about the person. Somebody that is not sick yet, but we want to make sure they don't get sick so they don't cost us a lot of money. So the main thing is when we get to them, we need to start seeing what are their behaviors, where do they live, what is their gender, what are the common things for this patient, what events did they have in their life, and how did they react to those events physiologically, so I can develop patterns about these particular patients. So I think that the patient engagement it's coming right there when all the tools get there for us to aggregate also the data that they generate into the enterprise data warehouses and using analytics tools.
And will Airstrip work in that space all the way to the patient, or will you partner with other people and just be kind of the data engine behind it? Or
so we always say that we have been a silent partner to the patient because we connect to everything that is connected to them. On the medical device side, we connect to all the data that is documented on them. And this is the time that we're all moving into that patient or person-centric model, and we're going to do it through partners. I think we already have innovated enough to create a platform that now we have to open it up to a shared value ecosystems of other companies that leverage from what we have done to be able to take us all together to the next level.
Excellent. So I didn't prepare you for this question, but I think it will be a good one you'll enjoy. Are you optimistic or pessimistic about the future of healthcare IT, and why?
So I would say that this is the time that I am most optimistic, because for the last 5 years I have spent a lot of time innovating, and at the same time I spent a lot of time trying to get the government to do something about it. I testified in Congress, I have done so many things, and absolutely nothing happened. So nothing could be worse than what I have experienced in the last 5 years, so I'm really hopeful.
Well, I'm hopeful too. I appreciate you taking time, sharing your insights. Once again, we're here with Alan Portela here at HIMSS 2017. He's the CEO of Airstrip. Go check him out, and thanks for joining us. You can find more great video content and other healthcare IT leadership at healthcarescene.com.